And President Uhuru Kenyatta has reorganized the National AIDS Control Council and expanded its mandate to cover more diseases beyond tackling the HIV pandemic. In an executive order dated the 5th of August 2022, the AIDS agency will now be known as the National Syndemic Diseases Control Council. And as Pamela Asigi reports, the government hopes to save nearly 25 billion shillings from these changes.
National AIDS Control Council.
Since its inception, the National AIDS Control Council has largely covered issues surrounding HIV and AIDS. But in what could be one of President Uhuru Kenyatta's last executive orders, he has restructured it to the National Syndemic Disease Control Council, which will have an expanded mandate to cover more diseases, including HIV and AIDS, sexually transmitted infections, malaria, tuberculosis, leprosy, lung disease, or such other related diseases as may be specified by the Cabinet Secretary. The executive order says that the new body, which will be a state corporation, will take over the rights, duties, obligations, assets, and liabilities of the National AIDS Control Council. The President further says in his order, any person who held office as a member of the board or as an officer or member of staff of NACC existing immediately before the commencement of this order shall continue to hold office as if that person has been appointed under this order. Apart from the staff at NACC, there will be 4 more positions in the council as it takes shape. The new council has been tasked with 11 duties, among them develop policies for prevention and control of syndemic diseases, mobilize resources for syndemic diseases control and prevention, and provide grants to implementing agencies. The agency will also ensure accountability in the implementation of syndemic disease programs in the country, develop strategies to deal with all aspects of syndemic diseases, develop national management information systems for syndemic diseases control. It is expected to mobilize government ministries, counties and institutions, NGOs, research bodies, the private sector, and universities to participate in control and prevention of the targeted diseases. This happening on a day the Ministry of Health launched guidelines to tackle HIV and AIDS.
We will not sustain the treatment program if we do not stem the new HIV infections. Indeed, Kenya must remain at the global center where the discussions are happening about any treatment. From price negotiations to the issues about patent, because we have a large group of people that we must continue keeping on treatment.
We are bringing interspersed new interventions to be able to fight HIV. Like, for example, if you take the aspect of testing, we are moving from 2-tier testing to 3-tier testing, which is going to eliminate the false positives.
The President hopes that this latest move will save the country close to 25 billion shillings a year. Pamela Asigi, Citizen TV.